Discussion 2, Hospital Comparative Data. The U.S. Centers for Medicaid and Medicare Services assigns quality star ratings to hospitals upon assessing their performance across 57 measures. Ratings can be used by healthcare consumers for hospitals selection, and hospitals can utilize these ratings for quality improvement. To determine the ratings for one of the hospitals that I worked at, I went to the Medicare Hospital Compare website and I entered the code for Grand Forks, North Dakota, selected All True Hospital to compare against the state and national data because in Canada it's a little bit different. So I'm going to do the Grand Forks All True Hospital, and I obtained the ratings for the following quality measures. Patients who reported their nurse always communicated well. It was 75% for All True, and the national average was 80%, and North Dakota was 84%. 30-day hospital-wide readmission was 13.9%, and basically the same as the national average, which is 14.6%. The average median time patients spent in the emergency department before leaving from the visit was 158 minutes at All True, and other medium volume hospitals 170 minutes nationwide, and North Dakota 161 minutes. My thoughts on the hospital ratings as compared to the state and or national averages. All True has received some recognition for patient care, including Healthgrade's America. It's one of the America's 250 Best Hospitals Award, and also it received multiple Healthgrade awards, including Critical Care Excellence, Pulmonary Care Excellence, and Stroke Care Excellence. The hospital emphasizes its commitment to patient-centered care and community health in its communications. So I don't think everyone has the option to choose their hospital, especially in sudden and emergent cases. So in my opinion, the fact that the hospital rating information is currently available to the public does provide some responsibility on the patient, meaning that they are assuming some of the legal risks of complications or injury by choosing a lower rated hospital for care. So according to some research, there is increased mortality risk with lower rated hospitals, particularly those with D and F grades. And so they've been also associated with higher patient mortality rates. Patients at C-rated hospitals face an 88% greater chance of avoidable death compared to A-rated hospitals. Patients at D and F-rated hospitals have twice the risk of dying from medical errors, infections, and safety lapses compared to higher rated facilities. Lower rated hospitals tend to have higher complications and adverse events. Patients undergoing knee and hip replacements at lower volume hospitals face up to 70% higher risk of death, 25% higher risk of readmission due to complications, and these facilities often have higher rates of hospital-acquired infections, as well as surgical errors and other preventable complications. So the quality of care issues, several factors contribute to the increased risk at lower rate hospitals. Less experience with complex procedures due to patient volume and potential issues. I guess in this research they said with cleanliness, equipment maintenance, adherence to safety protocols, higher rates of readmission, which can indicate problems with the initial treatment or follow-up care. So regarding the importance of hospital ratings, ratings shouldn't be the only factor in choosing a hospital, but they can provide valuable insights. The U.S. News and World Report and CMS Hospital Compare ratings evaluate hospitals on various quality and safety measures. These ratings can help patients make informed decisions about where to seek care, especially for complex or high-risk procedures. So it's important to note that individual circumstances such as proximity and insurance coverage may also play around hospital choices. However, being aware of the hospital's rating and discussing options with your healthcare provider can mitigate potential risks associated with lower rated facilities. So, just a quick note at the end that for example, taking a risk for a healthcare procedure, actually got laser eye surgery in Mexico, and I knew that and it was a great facility, beautiful, but I know that there's risks in a foreign country and things may not be, but I took that risk because it's like 20%. Cost is like 20% of what it is in Canada and the US. So in that sense, you should be aware that there are risks, but thank you.